Blood specimen is obtained by venipuncture. Basic metabolic panel, calcium, ionized. This panel must include the following. Calcium, ionized, 82,330, carbon dioxide, bicarbonate, 82,374, chloride, 82,435, creatinine, 82,565, glucose, 82,947, potassium, 84,132, sodium, 84,295, urea nitrogen, bun, 84,520. Basic metabolic panel, calcium, total. This panel must include the following. Calcium, total, 82,310, carbon dioxide, bicarbonate, 82,374, chloride, 82,435, creatinine, 82,565, glucose, 82,947, potassium, 84,132, sodium, 84,295, urea nitrogen, bun, 84,520. Electrolyte panel. This panel must include the following. Carbon dioxide, bicarbonate, 82,374, chloride, 82,435, potassium, 84,132, sodium, 84,295. Comprehensive metabolic panel. This panel must include the following. Albumin, 82,040, bilirubin, total, 82,247, calcium, total, 82,310, carbon dioxide, bicarbonate, 82,374, chloride, 82,435, creatinine, 82,565, glucose, 82,947, phosphatase, alkaline, 84,075, potassium, 84,132, protein, total, 84,155, sodium, 84,295, transferase, alanine amino, ALT, SGPT, 84,460, transferase, aspartate amino, AST, SGOT, 84,450, urea nitrogen, bun, 84,520. Obstetric panel. 80,081 Obstetric panel, includes HIV testing. This panel must include the following. Blood count, complete, CBC, automated and automated differential WBC count, 85,025 or 85,027 and 85,004, or blood count, complete, CBC, automated, 85,027, an appropriate manual differential WBC count, 85,007 or 85,009, hepatitis B surface antigen, HBsAg, 87,340, antibody, rubella, 86,762, syphilis test, non-treponemal antibody. Qualitative, e.g., VDRL, RPR, ART, 86,592, antibody screen, RBC, each serum technique, 86,850, blood typing, ABO, 86,900, and blood typing, RH, D, 86,901. Lipid panel. This panel must include the following. Cholesterol, serum, total, 82,465, lipoprotein, direct measurement, high-density cholesterol, HDL cholesterol, 83,718, triglycerides, 84,478. Renal Function Panel. This panel must include the following: albumin, 82,040, calcium, total, 82,310, carbon dioxide, bicarbonate, 82,374, chloride, 82,435, creatinine, 82,565, glucose, 82,947, phosphorus inorganic, phosphate, 84,100, potassium, 84,132, sodium, 84,295, urea nitrogen, BUN, 84,520. Acute Hepatitis Panel. This panel must include the following: Hepatitis A antibody, HOB, IgM antibody, 86,709, Hepatitis B core antibody, HCAB, IgM antibody, 86,705, Hepatitis B surface antigen, HBsAg, 87,340, Hepatitis C antibody, 86,803. Hepatic Function Panel. This panel must include the following: albumin, 82,040, bilirubin, total, 82,247, bilirubin, direct, 82,248, phosphatase, alkaline, 84,075, protein, total, 84,155, transferase, alanine amino, ALT, SGPT, 84,460, transferase, aspartate amino, AST, SGOT, 84,450. Evocative/suppression testing refers to a class of tests performed where one substance is measured both before and after the administration of another substance to determine if the levels are stimulated, evocative, or suppressed. They are most commonly performed in the evaluation of possible endocrine disorders. ACTH Stimulation Panel, for 21-hydroxylase deficiency. This panel must include the following: cortisol, 82,533 x2, 17-hydroxyprogesterone, 83,498 x2. ACTH Stimulation Panel, for 3-beta-hydroxydehydrogenase deficiency. This panel must include the following: cortisol, 82,533 x2, 17-hydroxypregnenolone, 84,143 x2. ACTH Stimulation Panel, for adrenal insufficiency. This panel must include the following: cortisol, 82,533 x2. Aldosterone Suppression Evaluation Panel, e.g., saline infusion. This panel must include the following: aldosterone, 82,088 x2, renin, 84,244 x2. Calcitonin Stimulation Panel, e.g., calcium, pentagastrin. This panel must include the following: calcitonin, 82,308 x3. Corticotropic Releasing Hormone, CRH, Stimulation Panel. This panel must include the following: cortisol, 82,533 x6, adrenocorticotropic hormone, ACTH, 82,024 x6. Chorionic gonadotropin Stimulation Panel, testosterone response. This panel must include the following: testosterone, 84,403x2 on 3 pooled blood samples. Chorionic gonadotropin stimulation panel, estradiol response. This panel must include the following: estradiol, total, 82,670x2 on 3 pooled blood samples. Renal vein renin stimulation panel, e.g., captopril. This panel must include the following: renin, 84,244x6. Peripheral vein renin stimulation panel, e.g., captopril. This panel must include the following: renin, 84,244x2. Combined rapid anterior pituitary evaluation panel. This panel must include the following: adrenocorticotropic hormone, ACTH, 82,024x4, luteinizing hormone, LH, 83,002x4. Follicle stimulating hormone, FSH, 83,001x4. Prolactin, 84,146x4. Human growth hormone, HGH, 83,003x4. Cortisol, 82,533x4. Thyroid stimulating hormone, TSH, 84,443x4. Dexamethasone suppression panel, 48-hour. This panel must include the following: free cortisol, urine, 82,530x2. Cortisol, 82,533x2. Volume measurement for timed collection, 81,050x2. Glucagon tolerance panel, for insulinoma. This panel must include the following: glucose, 82,947x3, insulin, 83,525x3. Glucagon tolerance panel, for pheochromocytoma. This panel must include the following: catecholamines, fractionated, 82,384x2. Glucagon tolerance panel, for insulinoma. This panel must include the following: glucose, 82,947x3, insulin, 83,525x3. Glucagon tolerance panel, for pheochromocytoma. This panel must include the following: catecholamines, fractionated, 82,384x2. Growth hormone stimulation panel, e.g., arginine infusion, L-DOPA administration. This panel must include the following: human growth hormone, HGH, 83,003x4. Growth hormone suppression panel, glucose administration. This panel must include the following: glucose, 82,947x3, human growth hormone, HGH, 83,003x4. Insulin-induced C-peptide suppression panel. This panel must include the following: insulin, 83,525. C-peptide, 84,681x5. Glucose, 82,947x5. Insulin tolerance panel, for ACTH insufficiency. This panel must include the following: cortisol, 82,533x5, glucose, 82,947x5. Insulin tolerance panel, for growth hormone deficiency. This panel must include the following: glucose, 82,947x5, human growth hormone, HGH, 83003x5. Metabolic Panel. This panel must include the following: cortisol, 82533x2, 11-deoxycortisol, 82634x2. Thyrotrophin releasing hormone, TRH, Stimulation Panel, 1 hour. This panel must include the following: thyroid stimulating hormone, TSH, 84443x3. Thyrotrophin releasing hormone, TRH, Stimulation Panel, 2 hour. This panel must include the following: thyroid stimulating hormone, TSH, 84443x4. Clinical pathology consultation, limited, without review of patient's history and medical records. Clinical pathology consultation, comprehensive, for a complex diagnostic problem, with review of patient's history and medical records. A clinical pathology consultation is a service performed by a physician, pathologist, in response to a request from the attending physician regarding test results requiring additional medical interpretive judgment. Pharmacokinetic consultations regarding therapeutic drug levels may be reported with this code.